I just want to make it brief, but I think it's important that we are covering also this problem about unproven therapies, because what we are discussing here is scientific analysis, scientific programs, which are okay, but they have to be clearly stated as a difference between the unproven therapies. And this is something which we are fighting for many, many months already. And Mickey Koh is one of the principal people, which is actually also at the ISCT and the WBMT, where we are trying with the help of the WHO to look that we can have some regulations about this. So the problem is not only that there are missing regulations, so the problem is also that, at least in Germany, we have the possibility to have a producer license, and they are checking this, but they're not checking the indication. So we have the problem. We had the problem of a company which was producing everything okay. They produced mesenchymal stem cells. They injected this outside the clinical protocol in the spine, and this is something which is really heavy. And I think we have, as a physician and as a person which needs to be which wants to prevent problems with, to patients and to people, I think we have to prevent this and asking clear regulations that if something is unproven, it has to go to ethical committee, the patient has to have consent, informed consent, and so on. I just want to show you this, this case where there was an injection of commercially stem cell clinics which tried to treat residual deficits from an ischemic stroke in China. But this is not it's not only China, it's a problem of the Philippines, it's a problem of many, many, many countries in the world. And as you can see here, there were cells which were coming from different sources, and even it was not really clear. You can see it here, where described are consisting of mesenchymal, embryonic, and fetal neural stem cells. And you can see that there was a tumor then at the end, which deteriorated the situation. So, how and where should unproven cell therapies treatments be delivered? I think that this has to be done only at specialized units that have acute supportive and ancillary units. Like CAR T-cell therapy should not be given in each hospital. They have to prove that they are able to deal with the complications, and this I think should be, actually the FDA has already mentioned that the physicians have to be trained about this. There must be a structural frameworks. The ICU should be in the proximity of the application of these cells, and there is standalone clinics cannot meet this criteria, and I think it has to be given in a way that according to the Helsinki Declaration, but also to other laws which we have for clinical studies. In Germany, we have also the necessity to have insurance, which is different than the insurance in the other country in Europe, because in Germany you have to insure also the doctors, which is included in another country. So we have a lot of problems in Europe, and we have to harmonize almost the same problems we had with the mesenchymal stem cells. everybody, it seems to be the same, but it's not actually the same. So there is the irreversible damage from unregulated administration. We have pressing medical needs of diseases that lack effective treatment, and everybody understands the pressure of the patient to go somewhere, even if it's hope. But hope alone is not enough. There must be clear information, and there must be a rationale to do this. And I think it's also important the price. If the price is too high, something is wrong anyway. What means too high? Usually we know how much is we are paying for per consultation. So I think if this exceeds by manifold this, there is a problem. And sometimes we are also pressed by the insurance company to tell that why you're not saying that this treatment is good for the patient, because he needs this treatment without any proof. So this is not the way to go. So we need to have protocols, we need to have IRBs or ethical committees, we need to have insurance, and we need to have license to produce this drug, and not just juvenile cells from some animals. When I hear all these things, it's making me just, yeah, at least unhappy. Also, the perception of stem cells and cell-based therapies in the public should be an issue, and the manipulation should also be controlled. So we have to look this very closely, and I think one way to do this is also to register these cell therapies, and we are working in Europe to register these therapies, because that's the first step to understand what happened. The back numbers, the numbers of cellular therapies is much higher than we believe ever, and we just see the problems and if they are coming. So the ISCT, which is the International Society for Cellular Therapy, has it's writing letters to governments and also the WHO together with the WBMT, and we are hoping to have these regulations. So one way is to characterize the unproven cell therapies. The first point is if there is an unclear scientific rationale to suggest potential efficacy, this is something which is quite, I would say, we should not support this at all. Lack of understanding on the mechanism of action and the biological function. So this is a point which is very weak, because for some time we don't understand everything, and sometimes it's just, I would say, driven by pragmatic way, like in stem cell transplantation or in mesenchymal stem cells, we don't know the mechanism of action. Insufficient data from in vitro assays, animal models, and clinical studies. So this is important, but you may know that we cannot make for every cell a animal model, because the animals have not the HLA antigens, especially if they are speaking about cells, and we don't need to have long-term toxicity if the patient is going to die in the next 3 days if he is not treated. So there should be a kind, I would say it, some normal reasoning, which usually doctors have if they are when they are treating their patients. Lack of a standardized approach to confirm product quality and ensure consistency in cell manufacturing. This is also sometimes a problem, because the national authority are asking us exact numbers. It would be the best if we have the same composition of the stem cells in each transplant. That's not always possible. And inadequate information disclosed to patients. This should be also an important point. And the administration is finally an important point. And if these treatments or experimental procedures are not registered. So these are important points which we should pursue. So we have, again, the need to register this, to look that every application is within protocol if it's unproven. And we have also the necessity to report these problems. Sometimes we are reporting problems from the protocol only locally. This, in the last 2 years, it never happened. There is for cellular therapies not a central registry, especially for non-commercial studies. So this is something we have to do, and especially if there is a long-term toxicity, we need registries, and FDA and also the EMEA is looking at this in the EVMT. And again, the patient choice is of very high importance, and patients and advocacy groups. So I think that these points will then be discussed within the WBMT and ICT with the WHO, and I hope that we are getting forward in this problem. And perhaps we can have an agreement at the ministry level around the world that this should not happen. Thank you.